Yes, sir.
Do you like to have water, ma'am?
The last slide is added by Krisha Sahni. She was saying for making presentation, you become from torso to you are changing in the skeleton. So she added that slide. Yes, sir. Over to you, sir.
So that is why when initially said that you want to data stretch, you will take everything together 3-4 hours or same day and all those things. You can easily imagine how it would have been if you
Yes,
have
sir.
taken this much of content in a single day. Okay. So first of all,
Right,
the
sir.
neuromanual therapy specialist course itself, you see that the people sometimes may be attending first time. They have not taken any neuromanual therapy course before. They can enroll. But still that first session should be for them to understand that core of what is NMT. Okay.
Right.
And what are all the options that is their full body.
Hmm.
So that is what is the day one, where with entrapment neuropathies and NMT. So when they
Right.
get the case examples, when you are taking the next session, that time they will relate it to the reality. Okay, how they are treating patients and how it has been neural mobilization and all that.
Yes, sir.
Second session, stroke rehabilitation, we have very good randomized control trials on neural mobilization. But many people do not use the neural approach in stroke rehab because they feel neural techniques, which is neurophysiological techniques are important, not the neuromechanical techniques.
Right, sir.
And especially neural mobilization or neurodynamics could not convincingly improve the stroke patients.
Yes, sir.
Because they have not done as neuromanual therapy. Okay. That is where the difference of NMT comes in the picture than the component approaches of neural mobilization or the neurodynamics. So that improvisation. So that is the major thing.
Right,
And
sir.
NMT, when it is given as part of stroke rehabilitation during the functional training, during the task, the problem is there, the upper limb or lower limb, what is the component that is the problem? That component, which nerve is responsible? If the patient is having an overactivity of particular muscles, which nerve is supplying that muscles? And immediately addressing the NMT component so that they can add an effective adjunct to the neuro rehab. So that is the second day. So it becomes a different one and it's anyway advanced.
Yes, sir.
Of course, when you are seeing about cranial nerve neural manual therapy, none of the physios will be aware of anything head or tail about how to use for cranial nerves.
Right,
Okay?
sir.
And it includes partly that cranial osteomanual therapy also. So there are cranial osteopathy or craniosacral therapy. So that also many people may not be aware. First of all, cranial nerve testing itself, it's only given for people who have brain injury or they are having facial paralysis, for example, Bell's palsy. People are aware. Otherwise, the cranial nerve examination itself routinely physical therapists are not performing. Okay, compared to a dentist who routinely examines the cranial nerves. Okay, because orofacial pain. If a patient comes with temporomandibular joint dysfunctions, rarely the therapist evaluates the trigeminal nerve. Okay.
Right.
So that we have upper trapezius trigger point, we evaluate the upper limb neurodynamic test. But a trigger point in masseter, we take the trigeminal or a visual symptom, which is visual fatigue, for example. We don't examine the external ocular muscles.
Right. Very
There,
true.
the third, fourth, and cranial nerves are coming in picture.
Right.
As you are experiencing that visual accommodation problem with glasses, without glasses, definitely optic nerve comes in the picture. So many things can be experimented. Of course, there are some amount of broken pieces of evidence here and there, and we compiled it as cranial nerve neuromanual therapy specialist.
Yes, sir.
So all these are different levels. You can't take it in a single day.
Yeah, very right, sir.
By any means, even if I am giving breaks, I am taking practical in between 1 hour, 1 hour, 1 hour. Also, In single day, it can never be taken. These three are three different courses.
Right.
And if you are conducting direct course, that means neuromanual therapy one day itself is a packed course. All techniques, practicing, skill, refining, everything, treatment. And the stroke rehab one day, it's fine. That's possible. Cranial nerve also one day, it's not possible. Because there are 12 cranial nerves with all these techniques. So that also will take minimum 2 days.
Right.
So it's actually a 4 full day course program of NMT specialist, or maybe 5 days. Comfortable, average
Right.
learner.
Right.
If online we are sending videos, people are watching 1 month, they are reviewing the study materials. After that, come for the course only for practicals. 4 days is possible. Otherwise, it always takes 1 week also. If it is only students, it will be 1 week. Interns alone, the batch is only interns. They have not been exposed to any of this all through their PPT. So in that case, all they know is only neural tension testing. Some they might know about slider or tensioner. That's all. More than that, they may not know. So in that case, this will go on for 1 week. So that is how that program has to be scheduled comfortably for the instructor and also for the learner. We might be, for example, we are able to take, but we think that when we take a PowerPoint itself, the attention span is 25 minutes. So 25 minutes when the topic, 2-3 topics, break. Next 25 minutes, then break. 25 minutes, then break. Or 20 minutes itself is better. Right. And 5 minutes for discussions or interactions and together in the break time. Okay. So that you will save time when it is online e-learning scenario. The next you are talking of what is called as the content in the slide. What can be improvisation is to see that the picture is the major thing. Okay, the picture is the big one. Little bit here and there. If full content is there, what happens is we cannot read the full content.
Right.
It is visually straining, it is time consuming, okay? And we'll only tell the one sentence about that slide. So why to write 5 sentences? So write only that one sentence. Don't put all the 5. That is why I say content of slides, if you are giving as a handouts to the participants, they are receiving handouts of the slides, then full content will be helpful. But the content of slide while delivering the lecture, it has to be short, more pictures. You have put, for example, 5-6 pictures. You can show each one in one slide also, because that will be more clear. Or marking that in terms of what is the movement, putting the text so that it is flexion of elbow. This is extension of the wrist. Which are the things which is being emphasized there, okay? Or marking with the arrow during the lecture, telling that when I am flexing the elbow, I am extending the wrist. So it becomes a slider, okay? So these things, as we make it more dynamic, okay? Animations in the slide, that is a passive dynamic one. Whatever the speaker can do on the slide, okay, with arrows and even a self-demonstration, for example. So as much as possible, how much you can show it on yourself and taking. So all these are actually adds on to the experience of the learner. Okay. And of course, unsolved problem is spelling check. Whenever it comes to slides, to ensure that give it to a person who's not a physical therapist, who just know English. Let them see for spellings, okay, and or grammar, okay, how we are using the English, the sentences, because that will also divert the audience when they're looking at the slide and they see that there is a spelling mistake in the title, okay. So these kind of things, And absolutely, delivery, the energy level of delivery will be maintained only if you give breaks. Remember that even for me, I can take whole day. But if I give breaks, 100% I am. But don't give means that 190, 80 is automatic to reduce. Okay. So that we should not make the participants also to be overloaded. Or even if a video also, for example, unless we edit the video, we cannot stop it at a topic. But if we are only stopping upper extremity, that is also length, long one. Lower extremity will be long only, it cannot be short. Time trial for initially beginning teaching, those who are taking long presentations, we should do a time trial to see how much it goes in my normal comfortable speed, how long it goes. But for people like you, to get time to present only is a very big blessing. Where to do a trial and to practice, okay, another 1 hour, 1.5, 2 hours, how it is possible. So all this. Most importantly, on behalf of the executive committee and also as the founder president of the AOMPT, I am pleased to recognize you with a certified NMT instructor. And you are going to be a resource person for neuromanual therapy. And you should start conducting the workshops and courses. So,
thank you, sir.
The practical techniques, of course, you need to do it on subjects dynamically, like, and take a video, and so that you have a video of upper extremity techniques, video of lower extremity, video of spine.
Right.
So that you can send me those videos. I can also review them, how you are doing.
Right, sir.
Some of the positions which, like, for example, the side lying slump test position and all, always make sure that the popliteal fossa side, you should not stand. Okay. You are standing on the knee side, patella side.
Okay.
Popliteal fossa should be exposed to the camera. Okay. Especially posterior side or lateral, common peroneal, all of them. It is the popliteal fossa side.
Right, sir.
We stand in the direction where the movement has to happen.
Okay.
So more to control and all that. You can just see the positions which you are and positions which is there actually in the course material videos.
Right, sir.
So you can compare and directly get that picture before you record the video of the techniques.
Right,
I want you to do that, so that shortly we'll come up with a direct workshop at Delhi where you conduct on NMT. Okay. So it's definitely a proud moment for the academy, and who more than Ritu ma'am will deserve to be the certified instructor, the only certified NMT instructor other than me, to actually take the NMT forward. Okay, so that is very, very important for betterment of humanity. Okay,
Yes.
so wishing you good luck, and we will now take a break, and then you can start with the case studies. And
Sir, case study we will discuss in the evening. We will do.
Okay, so I'm just mentioning break because for the
yes.
video it is, they don't know morning or evening.
Okay.
So that the next video will come after the while. Okay.
Right, sir. Right, sir. So thank you so much.